Yesterday we told you why we did it. Today we get to tell you how we do it, which is really exciting. Whether you're doing dentistry or a medical dental team or evangelistic team or working with a working witness construction team or a vacation Bible school team, whether you got 1 chair or 6 chairs, we're going to tell you how to do it efficiently from at least 30 trips. And every trip we learn more. And we expect to learn some from you because we don't have all the answers yet, but we keep learning. This first trip, or this first picture, is in Uganda. We took 2 dentists and a hygienist, or Uruguay. And
Uganda.
This is a 4-chair clinic in Guatemala. But going back to why we do it, dentistry, we want to reemphasize, has a unique opportunity because there's so great of a need for dentistry, as we pointed out yesterday. One, and to be able to heal people physically and help them physically and sets them up for spiritual healing, builds bridges, as it says in Ephesians. And we're contributing to the unity within the Church of Christ. That's why we're doing it, not just for the dentistry. This is a neat picture because there's 4 pastors here. This is in Moldova, which is in Eastern Europe, the poorest country in Eastern Europe. And this pastor right here, and there's a pastor in the chair terrified, so we're praying over him. Okay, because we got to take a tooth out on him. And so there's four pastors praying together, and that's the power of prayer there. And it all went well. This young man here is in seminary in Texas. And he met this guy's daughter, who is an orphan, and they adopted her. He's going to marry his daughter and has married his daughter. So he's there, and this guy here is in seminary under the tutelage of this guy, and this guy's got the biggest church in the area. So they're all praying here, and it all works out. But we're contributing to the unity within Christ. Now, this is the latest clinic that we had last month in Kenya. It's a 6-chair clinic. 1, 2, 3, 4, 5, 6 chairs. They had set this tent up for us because there was no facility that could hold dentistry, because this is 2.5 hours down a very difficult dirt road to get there. Now, from the time that we left the bus, never been here before, the first time this team had set up in this area, you get to have the privilege of greeting everybody. And then we set the clinic up. We carried 2 generators with us on the bus. We had to integrate the interpreters. We always give oral hygiene instruction and give evangelical message and everything, which Diane does, and seated patients in the chair. How long do you think it took? 40 minutes. Now that's doing all that in 40 minutes. And that's because we're organized and the team was organized. So what I hope to do is to tell you how we do it. Now, this was an experienced team. Most of the people had already gone with us, and we had several meetings beforehand, but we hit there, and 40 minutes later, all the chairs were full of patients. And everything worked.
How many dentists there, Bob?
6 dentists. Okay, so we're going to tell you how we do this.
We find that, of course, prayer is the most essential thing we can ever do in preparing for it. And we ask family and friends and Sunday school groups and everything to pray for us. We always begin every day in prayer with the interpreters and everyone involved. Judy and I were talking about this yesterday, and you try to grab the hand of a national if you can, so that they feel really included, that it's not just the white people and the nationals. And we're doing team building right here, where we're saying, go team. Up above, we learned in Mongolia that sometimes people don't want to hold hands a lot or something, so we do pinky prayers, where we join little pinkies. And they enjoy that a lot wherever we go. It gets a good chuckle, and that way people have their hands all clean, ready to go to work, so we do our pinky prayers. And this is when we were in India with Billy Graham Palouse here, the amazing evangelist that many of us heard and he could just pray heaven down, and we started with his team every morning, and it was really great. You see the Gillums in the back that some of you know.
The world is a big place, sometimes a scary place, and the opportunities are endless. So where do you go? And who do you go with? Okay, we have the basic belief that if you have the desire to go on a mission, you can go on a mission. Just a matter of priorities. There's nobody that can't go on a mission if you really want to go. If God's calling you to go on a mission, go on the mission. Initially, we suggest that you go with somebody. And if you can't go with somebody, tie in with the Christian Dental Society so they can help you go and talk to people that have gone before that'll answer a lot of your questions. Join up with your local church, which many people do, or with your local denomination, you know, like Missions of the World and Nazarene Compassion Ministries. You know, there's a lot of denominations that have organizations that go. Go with an established Christian organization who can use the dentistry to fulfill their mission and to build bridges. Now, we've gone with all these types of organizations, to orphanages, street kids centers, seminaries, child sponsorship projects, hospitals, outreach ministries, schools, summer camps, churches, and you all have more than we've gone to. The Christian Dental Society is going to be the #1 resource for people wanting to go on missions. And you know, Randy and the Society's working on the website, and we hope to make that the place to go for people that want to go on missions. We've gone several times with missionaries. A dentist will come to me and said, I've got family members in Senegal or Uruguay or Madagascar. Can you help me do a dental mission there? I want to go and visit my family. So we've gone on several trips that way. Search the internet. All the resources are going to be on the Christian Dental Society internet. If you've never gone to the Global Missions Health Conference in Louisville, Kentucky, it is the largest collection of missionary medical people and dentists gathering that occurs anywhere in the world. And it's an amazing conference. Huge mega church. You know, Charlie's taught there several times. A number of you have gone there. I mean, they have 2 floors of displays. There's probably 60 to 80 organizations that are there that want dentistry. It's just an amazing conference. If you've never gone, you can look it up on the website. But that's a cool place to go if you're looking for, you know, how you start doing missions, or if you just want to be encouraged.
You can also go to on the internet, go to finishers.org.
Oh, you're right.
And
Good.
they have everything on there, and you just tell kind of what you, and then they'll see the information.
Yep. And you can look on the internet, shorttermmissions.com. So there's lots of sites to go if you want to go. Something's hissing. Any better?
No, there's kind of a background noise.
You still hear it?
Okay, great.
Bob, while you're pausing, I got the impression this year in looking at the speakers and all for the Global Health Missions Conference in Louisville, that looked like it had moved more toward almost all medical oriented rather than dental oriented. Is that your impression? Or?
Yes, it's predominantly medical.
Yeah.
You know, that would be something we could impact as a society in the future.
Yeah.
I think that would be a good thing to do in the future, is to bring more dental into that. But yeah, it's 90% medical, at least.
We think it's really important to start with group cohesion when we're putting together a team. We've talked about the psychologist Bruce Tuckman a lot in our meetings, who goes through this group dynamic model of forming, storming, norming, and performing. We start by forming a harmonious group. We want to start by really thinking about how people come together. This is a comfortable stage where people come in for the first meeting that we have. They're on their best behavior. They want people of the team to like them. There isn't a lot of conflict in usually the first couple meetings. They want acceptance. They want to avoid conflict or any serious injuries, issues at all. They're trying to, in any injuries between each other, they're gathering impressions about each other, the scope of the task. They want to want approval of the other team members. So the leaders at this point are being very directive about what is happening, what the mission of the whole trip is going to be. And we always start with questions that people have to each answer as we go around the room, like tell something different about yourself that maybe no one knows, or tell a secret that you think that we would like to know about you before we go. We think that this is just as important as the details of the trip, as finding out things about everyone on that.
This is a travel book that we put together for the team that basically helps the team. Everybody gets one. It tells about the country we're going to. This is about Haiti, some of the things they need to learn. It's got a travel journal in it and stuff, so it's just a nice thing to have. You can just pass it around if you haven't seen it. Another thing that's nice to do after the trip is you can put together these booklets with photo pictures and everything, and memorabilia of the trip. So if you haven't seen this, this is one that we took a 6-chair team to Dominican Republic. So just a couple nice things.
So after that storming stage, and this is with almost any group, I kind of had it last week in Vacation Bible School and the people I were working with. You start with a harmonious group, and then there's a little storming time, and that's usually inevitable. You just have to expect that, where real issues and differences do come out. Conflict is more or less suppressed, sometimes less suppressed than you want it to be, but it will be there. It's very necessary for the growth of the team. There's a pecking order that people seem to want to establish somehow, so you have to deal with that a little bit. We emphasize real tolerance and patience at this point, where our goal is for open communication, emphasizing that everyone is safe to have input and to ask questions in the group and to share their concerns, and we'll try to answer that. We really stress grace at this point. We give a thing on our trips we call 3 freebies. 3 freebies and you're out, we say, but you're out of your comfort zone, you're out of your organizational pattern, routine of your life, so people will leave a purse here, or they'll do something stupid or say something stupid, and we'll say, well, that's your first freebie, and just let it go. We want them to feel like you don't have to be perfect to be on a team, but we will give grace with that. This team was very challenging that we took. We learned a lot from this team. They were pretty vocal, they were pretty abrasive, egotistical, some of them, and they were some non-Christians on this team. So we learned early on that we have to be very directive about what our expectations are for the group. We talk a lot about wearing modest dress, no alcohol, because we go to so many countries where alcoholism is such a problem, things like that. So God teaches you through your mistakes too, but it came together finally. The norming stage of group dynamics is when the team agrees on a goal and has a mutual plan of attack. Some have to compromise, and we talk about that. Some of you aren't going to get what you want all the time. We have to work together. Here, this team really worked well together after some meetings. These 3 dentists that we had, American dentists, trained the 4 young Egyptian dentists here, just in Egypt, last November, and it was just beautiful to see. And part of it was the preparation, I think, that we had been able to put into that. Now, your goal is to have a really highly performing team that works well as a unit, where they're very efficient and smooth at the job. And dissent may still come, but hopefully by this time, through team meetings, you've established ways for people to be tolerant of each other. There's trust, and the relationships can be handled more maturely. So that is a big goal of ours, to get that off the ground before we leave, if we can. In the top is our team to the Dominican Republic, and it was a very diverse team. When we left, we had 18 people, that 15 of them had never gone on a mission trip before, and we had everything from age 10 to 65. I think some of you saw the pictures of that team yesterday as well. But they performed very admirably. It took about a half day to really get it smooth. Bob was putting out fires all over the place for the first 4 or 5 hours just to get it rolling. It was crazy, but then it was just a wonderful situation, and as we said, they've all returned, and most of them came on that Kenya trip, and that's why it was so wonderful that they were able to set up so quickly, because they had been developed that together. The lower one is a 4-chair clinic that we had in Senegal that also worked quite well. Very important to become cross-cultural and to teach that in your team meetings. Just look at these people and how different they were out in the bush in Kenya, in the Maasai tribe, and we just think that that's something we will hear more about in the conference tomorrow. I think with Ed Pate is going to really address that, but it was so vital we wanted to bring it up as well. And culture shock is also a very real thing, especially with short-term missions. It's a real challenge because you have to get to understanding that culture very quickly. We find that it has kind of parallels with our other model that we had for group dynamics. It goes along with that whole setup. The first stage being a romantic tourist stage where you think, oh, everything's so quaint and so cute and so wonderful, and we're liking that a lot. And then suddenly you hit with the storming stage where you've kind of lost that loving feeling we talk about in that way, that suddenly your jet lag is taking over, your fatigue is kicking in, might start having some food issues, or the language definitely that Denny talked about. Suddenly you're just upset that they can't understand or whatever. A lot of other issues start coming in. And then hopefully a day or two into it, you kind of start recovering a little bit and have a little norming phase where you're feeling like, okay, maybe I can do this. I can adjust to this task and setting. And finally, the performing stage is acceptance, where you're feeling like the task has become a lot more manageable. This is a lot to do in a 7 to 10 to 14-day span of time to get through all of those phases and be working. And sometimes you have to come alongside people that, if it's their first trip and they're really struggling with that. And we've talked about that, I guess so. The nationals have stereotypes of us when we come in, a lot of times in countries. And they can see us as fairly aggressive, which we can be, and they worry about us, kind of judging them, being superior, acting superior. So we kind of warn our teams, please just talk about how we're sharing ideas. We're not trying to come across as we have more knowledge to just bestow upon you. So we try to overcome this by talking about that a lot in the meetings before we go. And we were in Mozambique. It was really interesting. The missionaries came up to us and said, well, you are viewed somehow between the cross of being Santa Claus, because you are so generous and you're bringing all of these things to give, and the other aspect is that you are like Superman because you have this wonderful technology that you bring, and you are having amazing outcomes to your treatments. So they view you between Santa Claus and Superman, and we just makes us a little uncomfortable. But we also have stereotypes of North Americans going into the developing countries, and we have seen all of these things, of course. You can see these things in America as well with people, but we try to talk about not worrying about that. We have found that people are pretty much people with the same needs everywhere. They all care about their appearance, how they come across to you. They want acceptance so much that we try to give that to them as well. And it is true that we have a lot more of advantages. We have more education possibly, but that is just by the grace of God. So we tell our teams, don't be proud of that, but just try to be really understanding. We are just thrilled to always go and be blessed by these people, because it is amazing for us to see what they do with the little they have. And they inspire us with their spiritual maturity much more sometimes than we have, because we are not forced to depend on God like they are. So there are so many great things to learn. I love their intergenerational families. I go back and say, oh, I wish we could have families that work together like they do in those areas. Look at this little home down here. We saw this in Kenya, and there were 4 people, I believe, that lived in the little house in the back, and that's the kitchen in the front. Now think of the front of your house. What would they see if they looked at a picture of your home? And that just tells you the contrast and the differences of what you're doing in a week's time, going to try to bridge that gap between what you have and what they have, and try to be friends. And it's just a mind-boggling thing, but with God's grace, we can do a good job of that if you think ahead about that. We also think it's really important to have on the tip of your tongue a testimony. So often you are asked to just say a few words. They want to hear you. They want to hear your voice. It's good to have it prepared in short snatches so that you can practice it so an interpreter can easily follow what you're saying. There's many practical good ways that you can find ways to write your own testimony. You want to kind of keep it brief, but with some really strong bullets, because we found that you usually use it somewhere. It's just good to have in America, too. You never know when you can slip a little something in with a neighbor or someone in your office. So it's just good to think about that and have thought through those ideas. And here we are. Bob is giving a little testimony in Aswan, Egypt, being interpreted by an Egyptian. And here in Mongolia, we went out with the Jesus film. We did dentistry during the day, Jesus film by night, showing it on the side of the van on this sheet. They had reel-to-reel, so in between changing the reels, I'm giving my testimony there. No lights out there. It's just stars only. Someone talked about that this morning. Just beautiful setting. These people had wandered in from their little gers out yurts that they lived in as nomads, and first time that they'd ever heard the Christian message, so it was really an amazing opportunity.
Now, this team building stuff and keeping harmony within the group and stuff, that's oftentimes more difficult than the dentistry we do. And so, right, Randy? You know, I mean, it's important for every person and everything you do. And so this type of team building stuff and realizing that people are going to go through a storming, norming, forming, and performing stage, and there'll be cultural shock and stuff. That's why we go over it in the meetings prior to it, because it sets the team up for success. So it's not just about doing dentistry, it's the whole package. Okay? Now, we're going to get into some nuts and bolts. The first trip we ever went on, mission trip, that Randy helped me set up, was to Nicaragua with our church in the middle of August. The wrong time to go to Nicaragua in the middle of August, because it was 100+ degrees, and my assistant interpreter here is fanning not only me from the heat, but from the flies. Because it was miserable temperature-wise, a great mission, and it didn't turn me off, but I haven't made that mistake a second time. Because we always ask, you know, like Billy Graham, I said, okay, Billy, when's the best time to go to India? And he said February. That's when the weather's the best, when people can get around, that's when we went there. We don't go to Mongolia in the middle of winter when it's 70 below zero. You go in August or July, right? So plan for good weather. This little kid here hadn't slept for 2 days because he had a toothache. Once we got his tooth out, he didn't even leave the clinic. He sat down and fell asleep right there. So that's just a sidelight. Now, your sponsoring organization, we don't go alone. We go with an organization that's established there. We're door openers for them. We're helping them. And they're the key to your success. And we've gone with 15 different Christian organizations, and they've all been wonderful. They plan, I mean, your airfare, what immunizations you need, your insurance, tourism. They answer all the questions. They're on the ground setting the stage for you. They pick you up at the airport, and they take care of you and protect you from start to finish. Okay, they provide the interpreters, because you've got to have an interpreter per dentist. They introduce a team to the organization's mission and use a team to encourage. And it's their responsibility primarily for the spiritual aspect of the mission. We're there to do dentistry and open doors, although we help them out some. They're the primary ones that we're helping out, and they know how to help spiritually more than we do. We don't even speak the language, but we can really open the doors if we work together. Okay? And you plan for a balanced experience. Okay, it does do you no good if you're dead tired and you make mistakes, or if you're got bad food and you're sick, you're ineffective. So you have to plan balance between work, your outreach ministries, your rest, relaxation, and some shopping tourism. You want to get it all in, and it has to be a balance. Immunizations. Don't take chances. Okay, here's a number of resources that you have. Centers for Disease Control, Travel-X reports, number of things you can do, but make sure wherever you go, you check and make sure you got the right immunizations. Traveler's insurance. $3 to $4 a day is worth peace of mind. Okay, and a lot of these come out of Ron Lamb's book. A lot of the sponsoring organizations will have an insurance company that they're used to using, that they're used to working with. We've never had to use it, thank God, but the peace of mind to know that there's somebody there to take care of you if something really happens. And the way they drive over there, you never know. Okay? It's the team leader's responsibility to let the sponsoring organization know what your capabilities are and what your limitations are so that your ministry can be most effective. Okay, it doesn't do the mission any good and you don't succeed if people have expectations that you don't fulfill. You can actually do more harm than good, and that was alluded to by other people. If there's a lot of people that have come from hours and miles, days away, expecting to get dental care, and you're not able to provide it, that kills the ministry on the ground. So they have to know two big things. Reasonable expectations. We're trying to do the greatest good for the greatest number, which generally means we're doing extractions or fillings on the chief complaint only. And we generally plan about one patient per half hour per dentist. That's somewhat reasonable to give you an idea so you can tell the sponsoring organization what you can do, and don't give me more than a patient every half hour. So if we're going to work 8 hours, no more than 16 patients. And that's something that you can reasonably treat and make sure that they understand that. And then they have to control the gate. This is down in Costa Rica with the Army working on school kids. But we have numbered cards or sign-up lists or some way that you can control the number of patients that are going to come so that the expectations are reasonable, that promises aren't made that you can't keep. Best to have a target population, like an orphanage, a school, a hospital, or something. But even when you go to a hospital, then each section of the hospital, like anesthesiology or surgery or their nursing, gets so many tickets, and then they come, because you can't treat everybody. And let them decide who you're going to treat and how they get the biggest bang for the buck. But you've got to have reasonable expectations, and you got to control the gate if at the end of the day you're not going to have patients that are going to be disappointed. And it really works great that you work hard at the end of the day, you've got everything done, and you go, oh, that was a great day. Now this, you can announce the clinics. This is in India, Billy Graham, and this says Dr. Bob Meyer in Hindi. At least that's what I'm told, okay? So you can do things to announce the clinic and whatever the sponsoring organization wants to do to make it work smooth and best for them, we put ourselves in their hands. I mentioned on power requirements. Okay, 2/3 of the world works on 220. Okay, we work on 110. 220, you can't plug your 110 into a 220. It'll blow it because there's twice as much current going through. Now, 110 is safer. You put your finger in a socket of a 110 and it will bite you. You know, it brings you back. You put your finger in a 220 and you grab the wire, it immediately will cause your muscles to contract. And you can't let go of that wire and it'll kill you. So 220, 240 is not as safe, but it's more efficient and requires half the size of wire to run that same amount of current through because it's going through twice as fast. So you can imagine a car going down a single lane road and it's going 10 miles an hour, there's only so many cars that will go. But if it's going 20 miles an hour, there's twice as many cars going down that road. And so 220 is actually more economical because when they went the rest of the world, they needed smaller wires to carry the same amount of electricity. And the wires were expensive, so they went to 220. And it's also more efficient. So you have to be aware that you're going to need a step-down transformer. Now, when you use your amalgamators and stuff, you need something that's got a little oomph to it, like this transformer. When you've got your hair dryer, which only uses wattage, 1600 watts, you can use a smaller transformer. But this won't work on your amalgamator. This will work to charge the battery on your cell phone or on your camera, and it's nice to have these, but to run your amalgamator, You use something like this. And a lot of the units will run 110 or 220. For example, this unit over here, you switch a little thing, change the fuses, it'll run 110 or 220. So power is the key. You don't need to know a lot, but you need to know some basics. There's different types of plugs and outlets that need different adapters. And I was talking, I mean, you got the big round hole ones, you got the square hole ones, and whatever country you go to, they've got different adapters. So you got to be able to plug in and know what you need to plug in. We use surge protectors to protect the unit, just the little ones that you buy at the store. And you got to have the proper size extension cords. Okay, when you're using all these units and you got 6 chairs going on, these little extension cords you get here on a 6 kW generator won't work because there's not enough power that can go through it. So you need a 12-gauge wire if you're using 110 to run a bunch of these units off a 5 kW generator. And if you do 220, you can use a 14-gauge wire. And so you need to know gauges of wire a little bit if you're going to run a bunch of units in order for the power to work properly. Now this information right here, and I have nothing to do with any of these companies, and these are not recommendations, this is just what we use. But you can use them if you want. But this has got a handout of every country in the world, what the voltage frequency is, what kind of plug you use with a picture of it, so you know what kind of plug, what kind of language you speak in the country. So there's resources out there. If you want to get any of these plugs, you can go to Radio Shack or something, and you can pay $15 for one of these, or you can go to this store and pay $2. So, you know, it's nice to know what kind of plugs you can get. You know, the small adapters, you can get the bigger adapters, you can get circuit boards, 220, you can get generators. But you need to know a little bit about power. Now, how do you tell how much power a unit uses? Like that unit right there, how much power does it use? Because if I'm running 6 of them, and I'm out in the sticks, how big of a generator do I need? Well, power is in kilowatts, which is voltage. Voltage is the 110 or the 220 times what kind of amps are in this thing, or what kind of little fuse. These units run 800 kW to run the unit, but it takes 1200 kW to kick it on, and then it runs. So you need 1200 kW. So I could run 5 of these units off a 6 kW generator, which we did fine. So you need to understand a little bit about how many units you got, how much power it's going to draw, and what size generator you need. Because a lot of the developing countries, they have a light switch on a little bitty wire that comes in there, and there's just enough power coming into that little church or wherever you're working to turn the light bulb on. But it won't run this unit, okay? So you need to know that ahead of time. Is like, I'm going with this fancy unit, and you may go and you have no power, not enough power to draw it. So you need to work with your organization to find out how much power they got and what you can run. Basic understanding of power, otherwise you're dead in the water as far as doing restorative dentistry. Ask questions anytime on anything, because we're nuts and bolts here, answering a lot of questions.
You carry a generator with you too?
Generator always get in country. They're easy to rent, and the sponsoring organization will take care of that. You just need to let them know what size generator. Okay. Equipment needed. Okay, you can do diagnosis, you can do a lot of gauze extractions, you can do oral hygiene without equipment, but everything is easier if you've got a setup like this. It will protect your back, your chair. It's nice to have high-speed, low-speed suction and air-water syringe, and it's not that hard to carry. All this clinic right here is totally functional. I mean, everything's plugged in, sterilization's ready to go. I can do restorative endodontics, extractions, and flippers with what I have right here, and we carried it all on the plane out here in the 50-pound bags. So you can do it. The portable chair, this is Gail Cheatwood's very durable, plasticized, lightweight. I put 2 chairs in one box, weighs 42 pounds, back-saving masterpiece, I call it. I mean, I've used a lot of different chairs, and I found out that there's no chair that works better than this, that's easier to get in the country, that's faster to set up, and it works great. I'm going to show you a picture in a minute of a 400-pound person on that chair, and it held up. Okay, the dental operating unit. You need high-speed, slow-speed suction air water syringe. Currently, I'm using a Septico's Task Force Deluxe unit, weighs 33 pounds. I put it in a Sears box to protect it. Dan Bell's been working on another portable unit that it's all electrical driven, self-contained unit. The Christian Dental Society has dental operating units that have a separate compressor, but there's a number of dental operating units out there right now, and currently I'm using this one right here. Uses 110, 220, 800 watts of power, but 1200 to 1400 to start it up. Okay, the light, I used to use a halogen on a tripod, and that worked okay, but now with new technology, I've got this little LED light that goes right on the hand, right on the thing here. Bright light. I use it in my operatory now. I don't even use the overhead light most of the time now. It's super lightweight. I mean, it weighs nothing. You can't even feel it on the head. And the battery lasts for 2 days for me. And I've got a spare battery. I mean, this is the technology of the future if you're going on missions or even if you're working in your operatory. How many have a light similar to this? I mean, quite a few in the room here. Because Surgicel has them, Designs for Vision has them. Anybody that sells your loops has those lights now, but that just happens to be the lightest weight one that I found on the market, and they'll give you a discount with the Christian Dental Society. But there's a lot of lights out there that are really good. So you need a chair, an operating unit, and a light. Other equipment, you need a dental curing unit. I used to use the old kind. Now everything's in LED, so it's real lightweight. Just a little lightweight lights. It's so nice and handy. Doesn't weigh anything. I still use amalgam in the field. First molars, if you put an amalgam in there, it's going to last for 30, 40, 50 years. You put a composite in there, you're lucky if it lasts 10 years. So amalgam is still a great restorative material in the field. Sterilization. Do not recommend the chemical disinfectant, especially bleach and some of the other ones. Your instruments will rust fairly rapidly if you start using those. It's so easy to use a pressure pot, which Diane's going to talk to you about in a few minutes. Here's where I get it from. They'll get it to you in a couple days. It's cheap, 50 bucks. The weight is a little extra weight that's on there. Gail's working with a friend to get more of those weights. And what that weight does is it raises the pounds per square inch in there from 16 psi to 25 psi and saves you 5 minutes on sterilization. I mean, if you don't have the weight, you don't have to have it. But it's nice to have that weight because it decreases your turnaround time for sterilization. Instruments. Okay. I used to do instruments in a lot of different ways. Tubs, try to pack it in plastic bags and everything. Since I've gone to these, any store that sells fishing tackle boxes, from Walmart to Sportsman's Warehouse or whatever, sells all these boxes to put fishing things in. And you can come up here and see them, design it for your things. They work perfect. They close up. You pack them. You know where everything is. You know exactly what you got. You can't lose anything. And I mean, this is a lifesaver on time and organization. So, and I put everything in these little tackle boxes because they pack so nice, and I know where everything is. So, how many instruments do you need when you go on the field? I mean, I'm taking from 1 to 6 teams along. Well, how many providers, and how fast can you sterilize the instruments? Okay, and what type of treatment? Are you doing restorative only? Are you doing extractions only? Or are you doing a combination? With the pressure pot, the turnaround's about 30 minutes. That means it's about 5 minutes to bring it to pressure, takes you 10 minutes that it's at pressure, and about 5-minute cool down. And you've rinsed the instruments ahead so that you can just switch it fairly fast. So if you take 30 minutes to treat a patient, you need 3 sets of instruments per provider for restorative surgery. And you just work from there. We do a fair number of exams, so you might have an extra exam pack or 2. So examination instruments, here it's all in one box. That's for 6 dentists. All set to go. I kind of put things together. Restorative materials. This is a gal from Moldova. saving her front teeth. And it's nice to be able to do that. I mean, that was her chief complaint. And you go to a field and you see something like that and you go, all I can do is take the teeth out. Oh, I can do this in about half an hour because I'm not doing any paperwork. We're setting them down. Let me take you through this real quick. What we do is the patient will come and I have Diane, my assistant, and an interpreter right here close. You sit the patient down and I've got a Mirror Explorer and an anesthetic syringe. Quickly I assess what's wrong. The dentist will put the needle on and I anesthetize the patient. Okay, that patient gets up. If they need an extraction, we'll give them a Motrin or Tylenol. The interpreter and Diane will do that. I'll take this tray and I'll go find the instruments that I need to do that extraction. I'll put them on the tray. And I'll set that tray down. While I'm doing that, the next patient comes in. I've got a second tray here. I find out what's wrong with that patient, anesthetize them, go take this tray, figure out what I need, pull the operative or surgical instruments. Sometimes we're doing both. If it's a kid and they got a first molar that's can be restorable, we'll restore that and then take out the baby teeth that's infected. But whatever, so I've got all the instruments for that. I'll set that down. They're switching the patients back. The first one's now numb. First one comes in here, set down, and I can treat the first one. The first one's done. Take the dirty instruments, take it right over here, put it right down there, and sterilization, Diane's going to take you through that. Then the second patient's in the chair. They've wiped it down. I've got the instruments. I don't get anything confused. I can treat the second patient. I don't try to treat 4 or 5 or 6 patients at once because you get all confused, but 2 patients at a time. And you never get anything mixed up, and it's always nice, and everything's on the trays, and it's clean and neat, and it just makes for a great flow. So there's no wasted time. And you don't need 2 chairs and bouncing back and forth. I bounce the patient. And nice things to have. I mean, the chair, you need something to hold on to because there's nothing to hold on to. So we let them hold on to something soft. We use protective glasses. We found out that a little pillow that Diane kind of sewed a shower curtain on so that we can keep it clean is perfect for their head. I put this on the chair, which is a rug skid, anti-rug skid, 2 foot by 6 foot, so that the patient is more comfortable in the chair and they don't slide. I mean, we have patient mirror here so we can talk to them, but everything's ready to go. But it's a very quick way to treat patients. I have rubber dam set up right here by me, all in this little box, everything I need to do, rubber dam, all self-contained, don't have to search for anything. To do prosthetics, when I'm working, I'll put a second tray right here. This has got my Vitrobond for deep composites, my burrs, wedges, etching agents, bonding agents, and stuff there. So it just comes right over here. And then all that restorative stuff is right in here that when I need it or need more or whatever I need. And I've got strips and bands and everything that you need to do restorative. So, and then this can go aside when I'm doing surgery, but it's always there and it's ready to go. So it makes it very efficient. And so you can do efficient dentistry, especially when you don't have to fill out paperwork and all this other stuff. But everything fits in these little fishing boxes. There's dental burrs. We carry, I have everybody bring a burr block, which is your normal burrs, but when you run out of those, everything is organized very efficiently and you can see it, 6 rounds, 4 rounds, 7406s, whatever you need is right there. Very, very easy, lightweight, weighs less than a pound, but sometimes you're trying to find burrs, it's confusing if you don't have an organization. So that's a way to organize it. An endodontic kit, everything to do a root canal is in this one box right here. Now we're not doing fancy root canals, and it's rarely that I'll do them on the field, but a central incisor that's essential, you don't want to take it out, or a canine, essential teeth, you can do a root canal. Not very often, but it's nice to have that capability when you really want to do it. Prosthetics kit. Okay, now we're talking about a little bit fancy, but I shared with you yesterday about the one guy with the front teeth here. Here's gal that runs the Children's Project for Mission of Mercy in the Dominican Republic and didn't have any teeth. Now she's got a smile. Here's a welder from Argentina, traveled around the world constructing churches. They would start with a tent facility that he would frame in, and they'd show the Jesus film there, start a church, and then they'd frame it. He's got teeth. Here's a church pastor and a district superintendent was tortured for being a Christian in Mozambique, and for 15 years he didn't have any teeth, and now he's got a smile. He was elated. So everything to do prosthetics is in this 5-pound box. So everything that I need to do prosthetics is right here, and so it's not that heavy. You know, it's basically you take it and that's my extra, you know, for the pressure pot. Because if somebody goose up on the pressure pot and burns your seal, you know, you might be. So I always carry an extra one that fits right in there. But I mean, you just take an impression with alginate. I've got teeth in here, and then you pour it in stone. And so I'll take the impression, pour it in stone right away, and then I'll go treat a patient or two while it's setting. And I'll break it out, and I'll fit the teeth on it, put some separating medium, and I'll salt and pepper it in, and deliver it. It takes maybe an hour or less of my time, but in between I'm treating patients, or I'll do it kind of at the end of the day, and you can give it to them the next morning or something. So I don't take much patient treatment time to do one of these, but it's very selective on which ones I'll do. But you get the biggest bang for the buck being able to do, you know, a flipper for somebody. And it just makes, for certain people, it makes a world of difference for them. It's like the prison ministry making him his dentures. He can smile. And, you know, so big bang for the buck if you can do prosthetics. Most people don't carry that capability, but what I show you is it's not very hard to do it. And it's a great thing to do. Nuts and bolts, medications. I don't take a lot of medications. I take ibuprofen and Tylenol for pain relief for the patients. I take some penicillin and clindamycin. You know, just in bottles. There's no. I don't need to take a lot of antibiotics because it's rare that they need any antibiotics or they've got an infection. But it's nice to have some if you need it. Traveler's diarrhea. Occasionally you'll need some Cipro. Blood pressure cuff and stethoscope is nice to have. I rarely use it, but it's just nice to have it. It's nice to have a first aid kit. I just kind of put it in this. It's got the decongest and you know, all the things you need for a first aid kit are basically in there. So it's nice to have. My emergency kit consists basically in this container right here that's got all my tools and spare parts and everything. I've got an EpiPen in there, a Medihaler, and a nitrostat. Don't need much more than that. And I've never had to use it, thank goodness. But it's there. A repair and maintenance kit. Something's always going to break a little bit, you know. So this Leatherman tool is great to have because I mean, when we went to the generator in Kenya, they had a plug-in that was specific only to that generator, no other plug. So I had to splice my wire into that plug so I could put it in the generator. But the Leatherman is really handy. But again, I got this little box, and I got everything in here from fuses to zip ties to different cords to some batteries to just all these things, and all these little spare parts, these little rubber gaskets and things that I find that occasionally you may need. Duct tape. I mean, you can do anything with duct tape, right? Take some duct tape with you. But you can't carry it on the plane because they consider it that you can tie somebody up with it and everything. And if I take duct tape on my carry-on, they take it from me. So I have to put that in the bag. You know, there's little plug adapters, just little things that people will lose. They'll lose the tip to your anesthetic syringe if you're not careful, that little tip there. They're just little things people will lose. Miscellaneous nice-to-have items. A dual-voltage travel iron. I don't care if my clothes are wrinkly, but Diane does. So, you know, alarm clock, because you're in jet lag a lot of times, and your time gets all confused, and they don't have alarm clocks where you're at, so it's nice to have. Some people can use their cell phones, but alarm clock's nice. Travel packs. You know, The showstopper, I say, is, if you lose your passport. Okay, so there's a number of different travel packs carry underneath your clothing. Okay, put your passport in this and your money and your valuables in this and carry it with you. There's some that go around your neck, there's some that go around your waist, but don't carry it on the outside, like people do in America here. It's too easy to rip off. Carry it under your clothing. So there's all kinds of travel packs. Carry your passport in that travel pack. Antiseptic hand cleanser. Everybody likes that now, before you eat meals and things. Extra copies of your passport. Small bills for tips. When you're traveling overseas, some people like some Ambien or sleeping pills or something to help them sleep to get over that jet lag. Paper and pens for journaling. And there's all kinds of things you can take, but these are kind of some of the things that we found that are useful to take. We're talking about supplies. You got instruments here, but how many supplies, disposables, do you take? Well, what are you going to be doing, surgical or restorative? How many days and how long each day and how many providers? So if you figure you're going to treat patient's primary concern only and average a half an hour per patient, it gives you a gauge to figure out what to do. 8 to 10 hour day equates to 15 to 20 patients treated, restorative and surgical, because I do a combination of restorative and surgical. It takes a little bit longer to do restorative, a little bit less time to do surgical, but the half an hour per patient is a pretty good gauge if you're up and running. 2 dentists working 5 days, 150 to 200 patients. Now this is Ron Lamb's book on portable mission dentistry. It was my Bible on portable mission dentistry. It's all on the website now, on this website. You can look up the whole thing, copy the whole book right off the website. Ron's done a super job with that, and that resource is available to anybody. And he knows more than I do, Ron does. But if you have one dentist working 5 days, it's going to see about 100 patients. I add about a 25% fudge factor. I've never once run out of anything that I needed. Praise the Lord. I've never not had my equipment work. Praise the Lord. And I've never lost anything on over 30 trips. Praise the Lord. So this works for us. And so here we go. 25% fudge factor. Gloves, match the size and type to provider. Some people have little bitty hands, some have big hands. So you got to match. 3 boxes for the dentist, 2.5 for the assistant. Anesthesia, I figure 2 carpules per patient, 4 boxes of 50. Needles, 125 of the sizes you use. Everybody uses different size needles. I'll use, and I put them in a little box because it's so easy to see. I know just what I got. When I got a big team, I'll just carry a little plastic bag, and then I can refill this because everybody comes and they use different needles, and you can see it. You know what you got. Okay, 30 gauge for the maxillary anterior, 27 gauge short for the posterior superior velar, and 27 gauge long for the inferior velar block, or whatever you want to use. But that's just a way to carry it, and I found out everything goes in those little fishing boxes, and it makes it so easy to organize and see what you got. Gauze, 2 by 2, figure about 10 per patient, 5 packages of 200. This is kind of how you figure out how much you're going to need. Okay, bibs, one for the patient and half for the tray. We take the bibs and we cut them in half because they last twice as long. So on this tray here, this is half a bib, but then and it fits just perfect, and then everything cleans off this tray, and all the bloody tooth and everything goes on here. So these trays are great. And with kids, you can cut the tray in half too, and you can cut down on the number of bibs that you need. But it's nice to have the bibs. Topical, I like to do topical, and little cotton tip applicators. Toothbrushes, I try to take toothbrushes. I take 1.25 per patient that I figure I'm going to treat because there's always ancillary people that need the toothbrushes. Disinfectant wipes, 1 container per dentist or provider, hygienist, and they work great. You can take this and put it in a little plastic bag and you use it a couple times, but these disinfectant wipes to wipe down the hoses and to wipe down surfaces, and if you get blood on these things, to wipe them down and everything, these work great. Take 1 of these per dentist for 5 days, and it'll do you good to help you with the disinfection. Oops, I know I'm going back. I'm probably driving Brian crazy.
Right. Things are good.
Whatever you do it all for the glory of God. Amen. So you get in the nuts and bolts and you forget You know, God's in charge. What does each dentist bring? When I take a number of dentists, then I have each individual dentist bring certain things. For example, their own loupes and protective eyewear for their assistant and their own headlight, if they can, because I don't have headlights for everybody. I ask them to bring 2 high-speed and slow-speed hand pieces, because I've got about 5 hand pieces, but I'm going to take a team of 6. I don't have enough hand pieces. And what we do with the dentist is I give that dental operating unit to the dentist ahead of time, and I say, you go home or you take it to your office, you put your hand pieces on it, and you use it. Because when we get to the field, it's not the time to learn how to use that thing. And that's part of the reason that we can go there and set a 6-chair clinic up in 40 minutes. Because they've already got their hand pieces on there, and they've already used it, and they know how it works. You know, don't take a new piece of equipment and expect them to learn it out in the field and everything. So that's all part of the meetings that you go ahead. I have them bring 2 of their burr blocks with their favorite burrs in. Everybody's got their favorite burrs. You know, I don't have a burr for everybody for every need, so I encourage them to bring, if they got any special burrs. There are, I don't know how many different types of composite and bonding agents out there, and I tried to provide that, and I said, no, I mean, some like this bonding agent, some like that composite. Bring your own bonding agent composite. I buy a little fishing box for them, and I said, you make up your own box. You know, here it is. Put the stuff that you want, you know, that you want to do restorative with it. I've got the amalgam, the amalgamator, but, you know, put your own composite and bonding agents, and once they see how it's done, it's easy for them to do that. I ask them to bring their own rubber dam setup, because everybody's got a different rubber dam clamp, and there's 10 different types of rubber out there and punches. So as much as I can, the dentist uses what they're familiar with, because they're more comfortable with what they're familiar with. Bring their own gloves and assistant gloves. Some like nitrile, some like latex, some like vinyl, you know, some like medium, small gloves. Let them bring their own gloves, what they're used to. Everybody uses their own different mask. You know, some like the cup, some like the ear loop kind, some like the tie behind kind. Let the dentist bring their own. It's not very expensive. Dentist's favorite surgical restorative instruments. Everybody's got a favorite, you know, luxator or forceps or whatever. Tell them to bring those. We mark them with a little rubber loops and stuff so they get them back. But I've got most of the instruments, and usually we go in smocks, so get a couple pairs of smocks. So that's what the dentist needs to bring. Gathering supplies. Am I going too fast? Questions?
Yeah, I want, when you do these flippers, do you have a standard tooth color that you use?
No, I've got a whole packet, and what I do is I lay them all out on a tray, because I've just got an assortment of anterior teeth. And there's, you know, 100s to 112s in here in different sizes and stuff. And then you just got to lay them all out and then figure out which will work best in that mouth. Because you've got the model so you can get the size, and you got the patient right there so I can get the color. So yeah. And you don't have an unlimited amount, but generally you can find one that's pretty close with what I've got there. And Ron Lamb helped me set up. I've got all kinds of teeth because he sent me a whole box of used teeth, and then I patched together all these kits, so it works good. So World Dental Relief is Ron Lamb's organization. I get a lot of stuff from him, my gloves and gauze and needles, and he's been a great resource for a lot of the supplies that we've got. The Christian Dental Society is great for, you know, if you're going on a mission, you got the dental operating units and the chair and the surgical restorative kits and the pressure pot and stuff. So that's a great resource. Your local dental supply rep, you know, whether it's Henry Schein or Patterson or whoever you've got, often can help you get some supplies and stuff from their organization. Your local church, it's always nice for a Sunday school class or something to gather toothbrushes for you or different things. Your dentist or your practice, I get a lot of the little piddly stuff, you know, right out of the practice, you know, an extra band or an extra this or that. Family and friends, you know, I've got supplies from all these people. You write them a letter, tell them what you're doing, you know, they'll send you some supplies. You know, Project Cure helped me set up the clinic in Egypt. They had supplies and hand pieces and stuff. So there's a lot of places that you can get supplies and stuff from. Okay, now that you got all that figured out, what you're going to take and everything, then you got to pack it for the plane. Okay, you have to pack a 50-pound, and I want rolling bags. You know, you can go get them. Now I've got these Sears boxes right now that really work good. They're $50 at Sears. They hold the dental operating unit. They work really well. And I used to weigh everything on bathroom scales. You know, you got a bag and you want to get it 50 pounds, so you lift the bag and you step on the scale, you know, or you try to put the bag on the scale. Now I use this little thing right here, and it's this one right here. And this is the lightest weight. You just pick it up and it measures to the 1/10 of a pound or 1/10 of a kilogram. It's real easy to carry. And then because I pack all my bags within half a pound of 50 pounds, you know, I lay everything out because I'm tight on weight and space. So this is the fanciest little thing. I mean, they have all kinds of these scales, but this is the lightest weight, easiest one to use that I've found. And I'm not recommending it. I'm just saying that's what I use. Okay. And the chair carries great. You put it on that Sears rolling box in the chair, and those big wheels, you just roll that chair right with it. You know, Gail's chair. And so when you're going through airports and stuff, those big boxes just roll it. So basically, if we take a couple, we tell the couple, I get 3, you got 4 bags, 2 bags apiece. I get 3 of the bags, and you get 1 bag. So I can take all my dental stuff in, and that works pretty good. So when Diane and I go, generally, we can go just with our backpack and our carry bag, and like the 4 bags could take the whole clinic without any trouble. This is here we are with the little roll bags, couple chairs. This is a 3-chair clinic that we set up in Uruguay. Here's a 4-chair clinic that we went down to Guatemala with, you know, with the bags and stuff. Customs. Most of the time, 29 out of 30 times, I haven't had any trouble with customs. This is the only time I've ever had any trouble with customs. I'm praying here. You know, we spent like 2 or 3 hours, and this is in Egypt. And they would not let me take the dental operating unit into the country. And they wound it with tape. They did a wax seal on it and everything else. Because I've been to Egypt twice before and never had any trouble. The week before we got there, they passed this insane law that says no used medical equipment can come into the country of Egypt. You know, this is a month before the revolution. But so they didn't allow me to take the dental operating units in because they said that's used equipment. And they went through all the rigmaroles and everything. But their necks were on the line if they did it. So, but fortunately, we had a dental clinic already set up in Egypt that wasn't being used. So it was mainly a teaching mission, teaching the 4 Egyptian dentists. So but they let me bring everything else in. All my instruments, tools, amalgamator, curing lights, everything. They just kept the dental operating unit, which we really didn't need because we could do extractions on the other 2 chairs and set them up, and we kept the 1 unit going for training the whole time, and praise God, it worked, and we didn't need it. But that's the only time I've ever had trouble with customs. And it's interesting, 2 months later, we went down to Uruguay, and they were starting to give me trouble because they said, you can't bring the equipment in without leaving, because they didn't want you to take new equipment in and sell it there. As soon as they found out that it was used equipment, no problem. But they weren't going to let me bring new equipment in. So it's just, you never know. But
Bob, what happened to your piece of equipment that was impounded there?
it took me 5 bribes and about $30 to get it back out. Because they sealed it and they put it in the container. When we went back out of country, we were able to get it.
So it actually was still there at the airport?
It was still, and they made very sure. I mean, it was official. It was they waxed it and they put this signet ring on it. I mean, they were. And I kissed it and said, "I'll get it when I get back." And it was there, but it took me a few bribes. Everything in Egypt is bribes, like it is in Haiti. I mean.
In Mexico, and when we came back through, you could see it right there waiting. But the man who had complained about it at the time wasn't there and wouldn't be there until Tuesday, so he was the one that had to clear it.
Yep.
You run into these screwball things.
Oh, you do. You can't. But that's why we cover our trip with so much prayer, because when it's covered with prayer, I mean, most of the time, I mean, a 6-chair team, I counted the items. You know, I got an Excel spreadsheet that puts 26,000 items. All the instruments, all the supplies, all packed in 50-pound check bags, and it works pretty fast. Another neat verse, because we pray throughout the mission trip, and God has always protected us. We've never had a bad trip, never had anybody get really hurt. You know, it's just, we're covered with prayer, and that is a biggie. And setting up the dental clinic, you kind of see it here. I mean, we just need a couple tables. Everybody sets up, everybody knows where it is. Table for sterilization, table for instruments, and we're ready to go. Now, Diane's turn.
We try really hard to have an interpreter, as he mentioned, for every patient. We really, really have our teams pray over this because we think they're essential, that they're nurturing Christians if at all possible, and then we teach them to tell us exactly what the patient is saying. And word for word, what the dentist says to them, we really talk about that, tell them to be really nurturing and hold their hands and really help them. And it's well worth it if we have to pay for an interpreter. We just think that that's money well spent as well. And this picture shows our little Honduran one, and she wanted to put on a mask for the picture. She just wanted to be important, but she didn't interpret with a mask. But she said, oh, if you're taking a picture, I want to be in a mask. The other one was in Moldova, and this man was just an angel. I'm just sure of it. He did everything completely right. He was such a good learner. We loved him. So we've had really great.
Charlie, I wish this guy could be with you, because this guy was sharp.
Yeah.
He could do it.
Now, I kind of had Bob put in this next slide about relationships because we struggled with this a lot on our first trips. The dentist has to mentally shift from how they treat their dental auxiliaries on trips because we are not trained. We're family members, we're church members possibly, we don't know a lot about dentistry. So the dental provider has to be very, very patient and very strokey with us. I just tell him, please, really give people a lot of praise, because we're really out of our comfort zone. The dentist knows what they're doing generally, but we just don't know. We're just out there. So we also talk about how people have different personality types, the Myers-Briggs personality test some of you may have had done before. And Bob and I are probably exact opposites. So we make a great diverse team. We look at different things, but it also caused a lot of kind of sensitivity in the beginning. I just was so conscientious. I wanted to please everyone. And so I would end up in tears because I was trying to take care of other people in the clinic. And he would need me to focus now, Diane. And I just couldn't. So at times, and so, wow, we had
There's certain times where you have to focus.
So I said, we have to put in a slide about this. You have to think this through. We even got to the point where we would have little code words, say, oh, it's getting hot in here, Bob, or something, so he would know that I was getting close to a meltdown. But so we think it's really important to show harmony between the patients. We don't want them to feel the tension. Yes. We don't want the interpreter to know that we're on a marital discord here. So, we have a little code word about it every day. So we think this is really important to think through very carefully how you're going to treat it. And if you have an assistant that is from your church or something, talk to them about this. Say, if I get a little short with you, just tell me right away that you're feeling stressed by this or something. It's just an important key. So we always talk about that a lot.
Yeah, any husband and wife that's gone on a mission probably can relate to that, right? Yeah, they're all raised their hands. Yeah.
Okay. Oh, the little picture down here, our daughters were 3 years apart in high school when we went to Belize, and they were irritable at home. They were sibling rivalry all the way, but we also found that it really brings people together all the way home. They were holding hands in the airport. We couldn't believe it. That was just the most harmonious they'd been. And also we'd worked it out in this top picture in Honduras. Happy times. Sterilization is my department, and I'm really thankful that I have a nursing background for that, so at least I know things from, he's going to be my Vanna White over there. But I like to know that from dirty, to clean, I knew that. I knew when to change my gloves. I knew things like that from nursing. I knew sterile technique. It really helps to have a medical person that has a little background with that to help with that. We found it's also hard to teach a local person, a national person, to do that. Just the communication, the language barrier is tough. I know you have to do that. But if we can have someone on our team, it just keeps everyone safer overall. I mean, I know you have to work real hard with that, Denny, when you're working with the locals. But To do the sterilization, as Bob showed you, they bring the trays over. We have a tub with a little bit of soapy water and scrub brushes and then a rinse one into the pot with a cup of water usually. You have to tell a little bit differences with the electricity going through, but you close it, put on the weight, the magical weight, and turn on the heat. It takes a little while for it to get up to what we call the chugging stage. Is what I tell people. When it's chugging really well, we set the timer for 10 minutes, and it chugs away. After that, you take it off the heat. The pressure steams out and takes off. You dump the extra little water, the hot water, into the area and then onto the tray immediately. They are so hot you don't want to touch them, but they will dry instantly, no rusting, and then goes back into the bins over there as well. Everything else we are wiping off with the chem wipes, the tubing, anything the dentist has touched over there. And we actually re-sterilize the suction tips as well. We just use them and send them back out. Now, I have a chart that we have developed over the time, especially when we started doing children. We thought they need something visual. We need to take this chart out, and I do it in groups ahead of time. We really stress why we're there, that God loves you. We come because we love them, and talk about that a little bit. And then we talk about, we're dentists at home. We want you to think about the pain you have in your mouth and how we can help you, into what you're going to experience in the exam. There'll be a little tiny mirror that won't hurt, a little instrument that won't hurt. Someone might hold your hand. They will have funny glasses on, and there will be just some of that strangeness so that they know what to expect. There were some questions about baby teeth versus adult teeth. They thought maybe you were taking out their tooth forever when we were taking out baby teeth, so we talk about how they get 2 sets of teeth in their life, explain that. Explain the injection if they're going to have it fixed, and that they're going to just have a little poke, and on into how they will be set up to be treated with a little patient bib and sunglasses and a bright light, and an assistant maybe holding your hands might have funny gloves on, that there'll be another person standing by that will help. I talk about the noise of the machine, and that we have a suction to pull out the water, and that there'll be a little instrument that will squirt water in your mouth, and that's just all fun, and all you do is have to lie there and just enjoy it. That everything will be taken care of. You won't have to spit, because we really don't like them to spit. That the assistant will help pull all of that out for them, and then we go into how the acid makes the cavities and explain all of the procedure about how you get cavities. They're always pretty surprised about that. A little basic nutrition: eat more of these kinds of foods, less of these, down here. And then into toothbrush and oral hygiene, even a little about floss. Try to explain that a little bit to them, although most are surprised with that. Say you can use thread or other ways, little toothpicks or that type of thing too. And then always end with the message that we come because we love Jesus, and we go around the world to make friends, and so that we will remember to pray for you and your needs, and you will pray for us, and we make that a mutual thing. So this has really helped. It seemed that the children are less afraid because we have done that for them. And this shows in Kenya when I had a group of students. We also take hygienists whenever we can. They beg to have hygienes. And the next slide is the hygiene. In DR, we had this wonderful little office, and she helped us a lot. We always give out toothbrushes and toothpaste if we can. We take a little treasure box with little toys and hope the kids will like that too. And we also I like to have a local, like in the top. She's a Honduran dentist. Give it if she can at all, because she can answer the questions. They like to enjoy having a local teach them. Down here in Senegal, they had a little tree branches, which you may have seen. They take the bark off and they brush their teeth with these. It's almost like a bristles of a toothbrush. So we were supporting with that. We were all brushing teeth with them when we were there. And down below, we had 400 kids at the Street Kids Center in Madagascar, and we couldn't possibly train them all, so we had the teachers come in. We taught each teacher. The next morning they were down at the water fountain with handing brushes to all the kids and teaching them, so sometimes you can multiply your efforts that way.
Now, how do you dispose of your waste? Okay, now that you've done the clinic and everything, We put everything in little plastic bags that weigh nothing. They pad everything. And so everything is stored in little plastic bags. The latex and the bibs, the plastic in the bibs and everything burns very hot. So we'll take the sharps, which we collect in a water bottle, just put them in a water bottle. We put the sharps on top of the plastic and light it on fire, and it burns, melts all the needles, melts all the glass, and there's nothing there that will contaminate as far as all the disposable waste. The suction, the blood and stuff, we'll take, and I mean, this is how the bathroom was in the Dominican Republic, but you know, whatever toilet or outhouse or whatever they have, we will dump the liquid waste down there. Now, we found out with sharps, with the needles, early on we had a needle stick trying to train, you know, a local person how to do it and everything. We've gone to the point now that the dentist is the only one that touches the needles. The dentist puts the needle on. When they get done, then the dentist takes the needle off and puts it in the little plastic bottle so that there's no chance. And since we've been doing that, nobody's been stuck with a needle. So that's just one of the things that we learned, you know, with everything on the tray. Rather than taking the tray with an anesthetic syringe on there, the dentist just takes a second to take it off because the assistant's got to clean the unit anyway, so there's a couple-minute turnaround between the units, and the dentist can do that easy enough.
Excuse me, well, I mean, where did you burn it? Just at a bonfire and burn it, or how did you?
In the developing countries, they burn everything. So you just ask them where the best place to burn it is, and either they'll burn it for you or you can burn it. But I don't want the gloves and needles and anything to go to a dump or anything. I want it to be burned. And in the developing countries, we've never had a place that we can't just, they've got a place everywhere that they just burn stuff. And we just burn it. And then I'm sure that everything is burned and there's no, we're not passing any disease anywhere. So all those paper products, your host will have somebody there that can burn it, or you can burn it yourself. It's fun, it burns really hot. Flames are about that high when you burn a lot. Does that answer the question? Always be flexible, patient, and resilient. This guy weighs 400 plus pounds. Where's Gail?
For a second.
Where did he go? I mean, I wanted to show him that, and the chair held this guy without any trouble. We took some teeth out on him. He was a guard in Aswan, Egypt. Look at this gal here. He is 4 times bigger than her, easy. Okay? This is an overnight flight to the Dominican Republic. You know, you sleep where you can sleep. This is on her knees in a ger in Mongolia. Another picture for Gail. When he comes back in, I'll show him these. Because Gail's going to Mongolia here next month, I think, right? Yeah. And we wondered, this gal was a choir member with Diane at church. She showed up at the meeting, unbeknownst to us, and said, God told me I was supposed to go on your dental mission trip. I heard you were having a meeting. Here I am. And, you know, God puts the teams together. We don't. And she became the assistant for our hygienist. And those two were like 2 peas in a pod. Loved it. And when we had a kid that couldn't speak or hear, she knew sign language. And we were able to take out a tooth on him with the sign language. Now, Gail, I'm glad you're back. Here's your 400-pound guy in a chair. He weighed over 400 pounds. And he sat in your chair.
And it held.
And it held. And that's the biggest guy I've ever had in the chair. So,
Insurance, though, right?
he's now dead, but
He didn't survive.
he didn't survive. But no.
Our treatment. He survived the
He
treatment.
he survived the treatment, but we went back the next time to Egypt, and we found out that we asked about the big guard, and he passed away. And this is in Mongolia, in a ger, and we're on our knees doing dentistry. Now, be careful in the ger. Don't burn anything in their little fire pot, because that's a sacred pot. You know, I wanted to put a gauze in there because right in the center they always have a fire going, but you don't, in the ger, you don't burn anything other than cow dung.
A yurt,
A
a little
yurt.
tent.
That's the ger or the yurt or whatever. So I'm giving Gail a hint there.
This is our last, we're getting to the end here with Acts. We're Paul just said we want to help the poor in any way that we can. It's more blessed to give than to receive. We've had to do a lot of other things besides dentistry. We were in Uruguay last New Year's. They didn't have patients for us. The clinic had been in this barn, and they desperately wanted it painted because Americans had left a spray painting gun, and Bob was the only one that knew how to use it, so he ended up spray painting all day long. We often do foot clinics or little superficial wounds just because they want us to. Here we're cleaning windows, our clinic in Aswan with a couple doctors' wives. Down here, the construction team was a little put out. They thought we had it a lot easier in our clinic, cool and everything. So we went out and dug holes with them one afternoon, and they loved us forever after that. They were building a conference center here. We always try to plan a rest day. After a couple days, we just need a break. Here we are resting on Gail's chairs just on a lunch break, and they are very nice for that, too, to stretch out the back and feel a little more comfortable. But you get really tired, so every 2 or 3 days, we try to do a little tour. Our 26-member group in Argentina took over this estancia. It's kind of like a ranch or a castle that was down there near Buenos Aires. We loved it. It was just a great relaxation way to end the trip, and we try to do that with a safari or something often.
So, more than anything, have fun and experience the blessings that you get from doing short-term missions. I mean, we had so much fun singing last night, you know, and here's our she's a German exchange student that we took down to the Dominican Republic, and she's there with a little ukulele singing with the kids. Where's our singer?
Judy's over there.
There, Judy. You could relate to that, can't you?
I don't play the uke.
But you sing beautifully. Here's our teenage kids wrestling. Every afternoon there was a downpour in the Dominican Republic. And they just had a ball running out in the rain. And it's not American Wrestling American, it's American Wrestling Nationals. And they're just having a ball. And here's all our kids that were watching our clinic in Peru for us and just joking around. You can have a lot of fun on the mission trips, and we do. And they're a huge blessing to us. You know, like yesterday we talked about all the reasons that we go, and now we've kind of gone over how we do it. And we'll hang around for questions, but I wanted to show you that it's possible to go and do, you know, quality dentistry with just what you carry in the 50-pound bags, and giving you some of the lessons that we learned to maybe help somebody else out. Is anything that anybody would like to add or questions on any of this stuff? Yes, sir.
I haven't done it, but I've heard that sometimes the opticians or
Optometrists.
people with the glasses are a really good asset for a dental community trip. You know, you can have a table of them doing the same crowd that comes in for the dental stuff.
Optometry is really cool because what they do is they take all these glasses that are, you know, they've figured out what the reading is in all the glasses, and they have a little machine that they can quickly, they're 2200 in the left eye and 2400 in the right eye, and they'll find a pair of glasses that'll match, and they just give it to them. I mean, it's a great ministry.
I'm glad you mentioned that. There's a dentist out of Atlanta that's been doing optometry for about 10 years. And he was going to come to this meeting, and then he had a conflict, and we're looking to maybe bring him next year to Philadelphia. And he can teach dentists how to do optometry.
Yeah.
We do optometry.
Oh, Gail does it.
Our group is called Dental Vision Mission.
Oh, that's
We
cool.
do dentistry, optometry, blood pressure monitoring, and glucose monitoring.
Yep, you can expand what we do in dentistry. Oh, yeah. This is a fully functional clinic. I'm going to do a little emergency care here in a minute, and we're going to put a crown back on a patient. But because this is not for show. This is fully functional. Somebody needs a filling or anything, we can do it right here.
Yeah. You don't need lunch.
We don't need lunch. Okay,
Done with the lunch.
thank you all for your attention. It's been great.